This is my postpartum maternal assessment. I would introduce myself. Hi, I'm Sierra. I'll be your student nurse today. Is it okay if I assess you today?
Yes.
And do you have any religious or spiritual concerns you would like for me to incorporate in your care today?
No.
Okay, for birth history, this was her first pregnancy and first birth. It was less than 12 hours ago. There were no complications or injuries to her or the baby. It was a vaginal birth. For vital signs, you want the blood pressure to be under 120/80, but you really want it to be under 140/90. Over that is when you start worrying about postpartum preeclampsia. You want her pulse to be 60 to 100, respirations 12 to 20, and you want her temperature to be under 100.4. Over that, I would monitor for extra signs of infection. And yep, that's about it. So do you breastfeed or bottle feed your infant?
Breastfeeding.
Okay, if she bottle fed, I would not palpate the breast. I would not want to start milk production, and I would educate her on wearing tight sports bras to again avoid any stimulation that would start milk production. Okay, so I would only unbutton the gown one shoulder at a time to maintain patient privacy and dignity. I would assess the breast for signs of mastitis, infection, or engorgement, and I would assess the nipple for cracking, bleeding, ulcers, or to make sure it's not inverted. Do you have any pain with breastfeeding?
No.
And do you have any other complications trying to breastfeed?
No.
Okay, so next for her uterus, I would have my non-dominant hand on the bottom of the uterus and my dominant hand on the fundus of her uterus, and I would make sure that the uterus is not boggy and that it's firm. If it was boggy, I would perform a fundal massage to make sure there's no extra risk of hemorrhage. It's right at the fundus of her uterus is right at the umbilicus, which is perfect because it has not been a day yet since she gave birth. The fundus should go down about 1 centimeter per day, so it makes sense. It is midline. If it was not midline, that's when we would worry about the bladder being too full. Okay, so have you urinated since you gave birth?
Yes.
Did you have any pain or burning while you tried to urinate?
No.
Did you notice a longer stream of urine than usual?
No.
Have you noticed more frequent urination than usual?
Yes.
Okay. Have you had a bowel movement since you gave birth?
No.
Okay. When was your last bowel movement before?
A day ago.
Do you have any history of constipation or problems with bowel movements?
Yes.
Okay. Next would be the lochia. So you want to make sure she's in the lochia rubra stage because she gave birth less than 12 hours ago. You want to make sure that it's a heavy amount of blood, like between moderate and heavy, but you don't want excessively heavy amount of blood. So every hour you would check the perineal pad. So I would check the perineal pad, and for her, I would expect, I found a 6-inch stain of blood on the perineal pad, so that's a moderate amount. And it would be a deep red color, it would be a fleshy, earthy smell like menstrual blood. If it was a foul odor, that would be worrisome, and I would think about infection. So her lochia is fine. Next, I would assess her perineum. She does not have an episiotomy because the doctor did not perform that. I would hope that there's no lacerations. So she has no lacerations, she has no redness, no edema, no ecmosis, no drainage, and the area is well approximated. I also want to make sure there's no rash or no other problems like that from sitting in the perineal pads for too long. I could also have her roll over and at this point assess her rectum for hemorrhoids, but since she hasn't had a bowel movement, we can leave that alone for now. Next is the Homan sign. So we don't do the Homan sign, but we do assess for thromboembolism. So I could assess her legs. I should make sure they're both bilaterally symmetrical. There's no excess heat coming out. Neither of her legs are more red than the other. There's no edema. Do you have any pain or tenderness in your legs?
No.
Okay, so that's good. Have you gotten up to walk yet?
Yes.
Okay, so that's good. And emotional response, have you bonded with your baby?
Yes.
Okay, good. So I would make sure that every time I go in, she's bonding with the baby, she's holding the baby, she's feeding the baby on time. If she wasn't, I would place the baby right in her arms for her, just kind of force it to happen. Do you have history of clinical depression?
No.
Okay, so since she hasn't given birth before, history of postpartum depression, obviously there's not going to be any because this is her first time being postpartum. Have you felt extra blue since you gave birth?
No.
Okay, so that's good. So I don't see any red flags about postpartum depression. And for the RhoGAM shots, if she was Rh negative, the baby was Rh positive, she would receive the RhoGAM shots so that her next babies did not, she didn't form antibodies that could harm her next babies. So, yep.